powerful Mantar. 401 pounds of him, McMahon.
As a WWF wrestler, Mike Halleck knows a thing or two about challenging opponents.
Oh, bad news. Uh-oh.
He made a living pounding people as Mantar, half man, half beast. But ironically, his biggest challenge came outside the ring, when he was diagnosed with diabetes.
I didn't want to talk about my diabetes. I just thought it was just, if I didn't talk about it, if I didn't think about it, it just would go away.
Not only did Mike not want to talk about it, he did very little to control it until he met population health coach Mary Jo McKenna.
I'm going to take your blood pressure.
A registered nurse who found a little tough love was the best medicine for Mike.
She says, Mike, she says, your blood sugars aren't changing. I says, well, it's because, I'm not taking the medicine. It's making me gain too much weight. I'm an athlete. I'm trying to lose weight, not gain weight. And she said, Mike, she goes, do you want to live or do you want to die?
Harsh words, but it was just what Mike needed to hear to start taking his condition seriously.
But if it wasn't for Mary Jo, I wouldn't be taking my insulin every day. She just never took no for an answer. And I'm glad she didn't, because now in a year and 3/4 time, my A1C has went from 12.4 down to 8.3. So I'm definitely on the right track. I'm getting closer to my goal of, 7.5. So it's I've come a really, really long way, and I feel better for it.
UniNet employs more than 45 population health coaches like Mary Jo to work in CHI Health primary care clinics throughout Nebraska and Iowa. They help chronically ill patients navigate complicated and often complex diseases like diabetes and high blood pressure. The service is free, part of value-based care, a strategy to lower the total cost of care while helping patients feel better and stay out of the hospital.
This is Nursing 101. This is where it should start, because this is, trying to keep them healthy.
And we just reach out to them and identify what they need help with, whether that's more education or figuring out what their barriers are. Are they taking their medications? What do they need to best manage their disease?
I feel like I make a bigger impact in patients' lives now than I ever did in the hospital, because I am trying to keep them well. I am trying to help them manage their disease so they can be active individuals in the community.
Managing disease is a team approach. In addition to the coaches, dietitians, pharmacists, and social workers are in the clinics.
Hi, may I speak with Daryl?
And at this service center, reaching out to patients, checking in, offering assistance. They know getting healthy and staying healthy requires a lot more than just taking a prescription.
And I remember working in the hospital and thinking, yeah, we send these patients home, they keep coming back with the same things. We tell them what they do, why aren't they doing it? And then working in this role, I realized how these patients aren't non-compliant, but there's some kind of roadblock keeping them from managing their health care. Whether that is they're dealing with chronic pain issues, they can't focus on, watching their diet, or there's financial, issues where, they're not taking their medications. They didn't pick them up because they don't have the money.
It's surprising how many people just need a little bit of assistance, a little bit of direction, a community resource. It might be federal, state, it might be a local resource, just something to help them through a rough spot or to kind of get them back on the right track.
Getting patients on the right track is what UniNet and CHI Health do every day. Mike Halleck is living proof. With a coach in his corner, he's finally managing a chronic condition that for years had the upper hand.
I mean, she's been very, very helpful, so I'm very, very grateful for her to be in my life, that's for sure.
For UniNet, I'm Mary Williams.